Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Still breakfast time somewhere. It's Wednesday. And it's cold. Very cold. I don't like cold. Uh-oh. Okay, great. I was a little worried it was going to supporters only. Hi, Ashley. So Gwen made me figure out how to do Instagram and Facebook Live together. I'm working on it. I think I got it. Cold in Ohio too. Frost in New York. Ugh. Yeah, we're supposed to have frost Friday morning, I believe. So I gotta scoot a bunch of stuff into the greenhouse on Thursday morning. Ugh.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Yeah, I know. Frost in Illinois. Yes, I think it's cold here, and poor Joey is moving here from Florida on Friday, and we're having a very cold front coming in this weekend. I feel really bad. But then it's going back up to 70 at the end of next week. So today I was going to rant, and I don't think I'm going to rant. I think I'm going to plead. I don't know. I have snow in Pennsylvania. We're near Pittsburgh. Of course, it's snowing. So I've seen so many posts on social media that I just find disturbing, sad, totally sad. So I think that we have all gotten really jaded about what we think is a good longevity for our pets. And, you know, Karen and Rodney just came out with the Forever Dog, and they're talking about our dogs living at least 2 decades. So we are looking to turn back the clock and go back to how things were back in the 70s, where a lot of dogs lived to be into their late teens, and that was much more commonplace. Somewhere along the way, we decided that it's fine for dogs to die between 10 and 12 and cats to die between 13 and 15. And I don't agree. I really don't agree. We've had, Scout lived to be 18, Charlie lived to be 19, Shotzi, who was a 50-pound dog, lived to be 17 and a half. Our kitty cat Star lived to 21. Millie lived to 17 and a half, who's our cocker. And to me, that is what we should all be looking for. We should be looking for our animals. I think we should set our goal to be 20. Now, certainly if you have a Great Dane, a Wolfhound, all right, we might have to back that up a little bit. But why do we think that these large breed dogs have a life expectancy of 7 to 9 years? What's that about? Why? I mean, we've had Great Danes using alternative medicine that are living to be 15, 16. Why can't we set that as our goal instead of saying, oh, he's old when he's 11 or 12, and just thinking that is normal. So when your animal starts, it can be a dog or a cat, when your animal starts having different behaviors, they start having urinary accidents or stool accidents outside the litter box or in the house or in their bed. They're drinking more, they're peeing more, they can't make it to the door to get outside because they're having to urinate buckets full every hour. And I saw a post where somebody chalked that up to the dog had dementia. Now, they admitted the dog was drinking and urinating a lot more, like asking to go out all the time and having accidents in the house. I think he's got dementia. No, I think he's got a medical problem, guys. And if you have an older animal that You had a kitty that was 23. It's awesome. If you have an older animal that has behavioral changes, pacing in the middle of the night, barking at nothing, staring into the corner, not getting in and out of the litter box, having urinary accidents, appetite drops off, vomiting, diarrhea that are new. Yes, they're making a mess of your house. They're keeping you up at night. But you know what? There's probably a good reason for that. How about they're losing their vision, they're losing their hearing, and they're confused? Don't chalk it up to dementia. Maybe there's an underlying medical problem. Your dog or cat suddenly is having urinary accidents all over the house. Hey, maybe they're diabetic. Maybe they've got kidney disease. Maybe they have a bladder infection or a kidney infection. Let's get a workup. Don't immediately jump to, how do I know it's time for euthanasia? Well, why don't you have a conversation with your veterinarian, get a physical exam, get some lab work done, get some diagnostics. Maybe you have something that is very treatable. Why do we think that he's 11, he's old? They're not. That's not acceptable to me. If one of my animals suddenly had a change in their patterns, they're drinking, they're sleeping, they're eating. I mean, Stewie's a pain in the neck with eating. He wants to be hand-fed most of the time. He's much better on his platter, but he's a slow eater. And the puppy comes over, he eats very fast on the days that he eats. The days he doesn't eat, he doesn't care. But he'll scarf down his food and then run over and try to steal Stewie's food as well. That's normal for Stewie. He's just a slow eater. He kind of has to smell it and pick at it. He likes to be hand-fed. That's Stewie. That's a normal pattern for him. But if Gabby started doing that, I'd say, oh my gosh, what is wrong? Something is wrong. We need lab work, we need x-rays, we need diagnostics, we need to figure out what's going on. Our cats are pigs. Our cats eat everything all the time. If one of them started skipping meals, if one of them started vomiting their meals, if one of them had diarrhea, I would know that was unusual for them, and I would want to get a workup. Cheyenne Nieves, I don't know if she's on, but she'll appreciate this because she changed the hay on her mini horses a couple of weeks ago, and one of them developed diarrhea. We got our new hay in this weekend. My little Pinto mini horse, he is old, he's like 18, 19, he got diarrhea from the change. So this morning, when we were cleaning up, said, we got some diarrhea, there was a diet change, I know what caused this, so let me get some probiotics and some biosponge into him, and we're gonna get him treated. But I mean, we've got a 22-year-old mini horse out there, and I think they're 22 and 20 or 21 and 19. To me, I don't think they're anywhere near the end of their life. I mean, I expect them to be here for a very long time. I think we need to help change people's expectations. And when you see people on social media saying, my dog or cat is peeing all over the house, I just can't take it anymore, I'm taking them in to be euthanized. The first question you need to say to them is, did you do a workup? Did you try to figure out why they're doing it? Like, let's not be so quick to jump to euthanasia just because we can. We can't do it for people. We wouldn't do it for people. And I don't think we should be so cavalier about it with our pets. And I know I'm preaching to the choir because you guys wouldn't be here. But we need to educate other people that when our pets are showing these weird behaviors. For instance, somebody said their dog had surgery a couple of weeks ago, and the dog is now being snarfy, behavior change, like trying to hide, get away from everybody, lashing out at others. And that dog is just saying, I've got pain. I don't want to be touched. I'm painful from having surgery. I probably need pain meds for a little bit longer. I need, some aftercare. It's been a couple weeks since surgery. We would think that maybe everything was healed and everything is good. No, the dog's behavior is saying, I still have something that needs to be addressed here. So we don't want to look at that dog and go, oh, geez, you've turned into a nasty dog. You're off to the shelter because you have a behavior issue. No, the dog has a behavior issue for a reason. And I used to see this a lot when we were doing chiropractic on horses. I said yesterday that we used to do a lot of chiropractic work on horses. A lot of times the reason we were called out is because the horse suddenly is bucking or balking or refusing to take a lead when they're cantering or refusing to go over a fence in a jumping class. Well, that's because they've got pain. They're just saying, I can't do it. I just can't do it. And that was the most rewarding thing about being able to do chiropractic on horses, is that we could take an animal who had a bucking problem or some sort of behavior problem or balking at something, and we would adjust them and take the pain away, and boom, right back to being the happy camper, well-trained animal that they want to be. Sometimes people say, oh, my dog is peeing for spite, or my cat is peeing on my bed for spite. They don't do that, guys. Spite isn't an animal thing. There's no spite. I'm trying to tell you I have a problem. So yeah, maybe feeling messed up from the anesthesia. Absolutely. So, when animals have behavior changes and lifestyle changes, they're just trying to tell us something, and it's up to us to figure out what that is. And sometimes it can be a little difficult, and sometimes animal communicators can help. But yes, there's so many things that we can do for these guys. So I just would implore you, when you see that kind of stuff on social media, really try to coach people into, try to be nice about it. Try to coach people into, hey, have you looked to see, is there an underlying medical problem that might easily be treatable? Maybe not so easily, but maybe easily treatable. And maybe your animal has many years left in their lifespan, many happy years. So, okay. Yes, euthanasia should always, always, always be the last resort. I absolutely agree. Absolutely. You had a miniature poodle named Tiny that lived till 19. And a small breed like that, they should. They absolutely should. And that's our goal, folks. That's really our goal. And we want it to be a high quality of life. I don't want to keep them alive just to keep them alive. I want them to have a high quality of life. So it's, their health span as well as their lifespan. So, okay, guys, I'm going to get going. And I may or may not have some music for you. I have consultations today, lots of work to do, working on 2 courses right now. Somebody says the audio is breaking up. I don't know why we're having issues. It doesn't break up on my end. So we're generally going to be live on Instagram, and then these are posted to YouTube. So if you're having problems with it breaking up on Facebook, check it out on one of our other platforms. And hopefully you can get a better recording. And we are working on it.